Autologous stem cell transplantation is a well-established treatment modality for multiple myeloma in the frontline setting in the relatively young and fit patient. And we've been performing auto transplant for more than 3 decades, and the efficacy is there over the long term, and the safety is also well known with less than 1% transplant-related mortality. Obviously, now we have the cellular immunotherapies, a new generation of cellular therapy, and one may ask the question, can we replace auto-transplant in multiple myeloma with CAR T cells? And this is a fair and highly relevant question from a scientific and medical point of view. And we have similar stories in non-Hodgkin lymphoma, where, for instance, in some entities and some subgroups, actually CAR T cells prove to be superior to auto-transplant in the relapse setting. So are we going to see this in the myeloma field, in the frontline setting? I don't know the answer, to be honest, because these trials are currently ongoing. And given what we know about the relatively long PFS with the current treatment, auto-transplant treatment approach in myeloma, it will take us some time before we get the results, because I would kindly remind all of us that today, with a quadruplet induction like dara-VRd, daratumumab, bortezomib, lenalidomide, dexamethasone, which is the most recent, I would say, these are the most recent data from the Perseus trial, followed by auto-transplant, followed maybe by doublet maintenance with dara and len, you are going to achieve something around 84% progression-free survival at 4 years. So you would imagine that if you're going to do better with your CAR T cells, it will take some time. Obviously, the safety profile of CAR T cell is different from auto-transplant. The other important thing is that until now in the relapse setting, we envision CAR T cells as a single-shot treatment. Here, in the ongoing randomized trials with CAR T cell in the frontline setting, challenging auto-transplant, there is some form of maintenance. So maybe we're losing the advantage of having a sort of a single shot treatment. So definitely, let's say in the next 10 years, we will see some great results. Hopefully CAR T cells will prove to be superior, because then we will move to the next generation of cellular therapy, and auto-transplant would retire nicely. But we should not neglect that the goal also is about accessibility and affordability. And we have to advocate for this. And I'm mentioning this because auto-transplant is accessible, easily accessible in many places. It is affordable even in low and middle income countries. It may not be true today it may not be true for CAR T cells, unless of course we see a significant development and widespread of the use of academic CAR T cells. So putting all this together, it's really very exciting for the future.